Hi, in this video I'm going to demonstrate the skill of transcutaneous pacing. This is only an introductory video. This is not a patient assessment video. You may see some steps that's omitted from our actual patient assessment, but we're just going to focus on the skill of transcutaneous pacing. Hey, welcome to our ambulance. Before we begin the skill, there's a few things we need to check. One, we need to make sure we have appropriate equipment. So we have our monitor and defibrillator. We have our electrodes, and we have our pacing pads and pacing electrodes. Again, I already mentioned that this skill, we're not actually performing patient assessments. We're not obtaining a sample history. For the purpose of the skill, we're going to pretend that the primary assessment has already been completed, an IV has already been established, and the patient is receiving adequate oxygenation if needed. So let's dig into the skill and show you exactly what we need to do. Ms. Jones, I'm going to apply these little sticky pads to your chest and arms to check, keep an eye on your heart rate and if there's anything wrong with it, okay? If you have any problems or any complaints, make sure you let me know. Ms. Jones, can you hear me? Jones, are you still with me? Miss Jones, your heart rate is really slow, and you're not really with me right now, so I'm gonna have to put some other little pads on your chest. I'm gonna have to try to stimulate your heart to beat a little faster, okay? Check your blood pressure. Okay, Ms. Jones, your blood pressure is really low right now. I'm gonna have to send you some small shocks to your heart to get it to beat straight. It's called pacing. Okay, so as I'm pacing, I'm looking for pacer spikes, which I have. My rate is set at 70, and that's automatic according to the monitor. I can adjust that if need be. So I'm going to increase my voltage until I have capture for each complex. Okay, so I have pacer spike followed by a QRS complex. It shows we have capture. I'm going to set that, and that is set at 55 milliamps. I'm going to assess for a pulse to make sure that I have a corresponding pulse with what I'm seeing on the cardiac monitor. We will reevaluate our patient, reevaluate blood pressure. We will adjust as needed for the pacing. Once this is set, we will have to make sure that we're monitoring for to make sure that we still have capture, that we're not losing any complexes, and if we were, we may need to increase the voltage, increase milliamps until we get to keep capture there. Other than that, we're going to just reassess frequently, and then we'll continue on their patient assessment. That may include any pressors or boluses to increase blood pressure.